Thank you for joining this BVNA VNAM interview, whether you're watching this as a video or listening as a podcast. I'm Charlotte Bullard, BVNA's Learning, Development and Communications Manager. For Veterinary Nursing Awareness Month 2024, we're celebrating progression and also the 20th year of raising awareness of what veterinary nurses do. To mark this special year, we'll be delivering a series of interviews just like this one with inspiring registered veterinary nurses who have been part of the profession for 20 years or more. We'll be reflecting back on where the profession has been and where veterinary nursing could go in the future. So I'm joined today by BVNA's very own Nikki Ruedisueli, who has been qualified since 1985. Sorry to give that away, Nikki.
I wasn't going to say that.
And is currently Editor-in-Chief of the VNJ, which is BVNA's membership journal. So Nikki, over to you, I guess, to introduce yourself.
Well, yes, as Charlotte very kindly said, I am a registered veterinary nurse. And what's amazing, I think, is that I am still veterinary nursing at the age of 61. Oh, how we laughed. At my local wonderful veterinary hospital in Lincoln. So I do weekend shifts there. And that's really just to keep my hand in. And remind me what it's all about. So I did qualify as a RANA in 1985, so that shows how old I am. And I qualified at Liverpool University Small Animal Hospital. So this was when it wasn't a degree or anything like that. It was actually an MVQ, if you ever remember those. So back in the day, so level 3 qualifications. And we have I know a lot of nurses here is talking about the little green book. So it literally was this size. And it basically just had a list of pages and pages and pages of the practical tasks that we had to be able to do. And basically, I think what we used to do is just go up with the book and say to a vet, can you just tick these and sign for us? And they just tick them without really looking at what we were doing. I shouldn't have said that, should I? Just put that out of the recording, it'll be fine. Anyway, so we had the famous little green book. We did have practical exams, but they weren't objective tasks. So like now it's you do a task, you do it and it gets a tick. It was basically an examiner talking to us and asking us. I can remember my friend Alison being asked to build an anode or something from an X-ray machine. I wouldn't have been able to do that, but bizarre tasks that we were asked to do. And then they were questioners on us. So it is very, very different to how we're examined now. It's a huge difference. And also having the day one skills and competencies. So I think it's much, much better now. But yes, in the good old days, I even had to wear the uniform with a cuff around my sleeves. I had the apron. I didn't have a hat, but I did have an apron, and I actually even had to iron it, which was quite an experience for me. So yes, that's how I qualified.
Fantastic. And I guess you've touched on this from an education perspective, but what progression have you seen in veterinary nursing profession since you joined, and especially within the last 20 years?
Wow, huge, huge amounts. I mean, I think the main thing that we've seen is the degree. So the bringing in of the degree, and still don't know whether that's a good idea or not. But the great thing about, I think, implementing the degree is that people then became aware that there was a greater depth of knowledge that veterinary nurses had. And it started, I think, the ability for career progression. So when I first qualified, you were a vet nurse or you were a head vet nurse, and that was it. And so I think now the big difference is that we can have a career pathway. And I think perhaps the degree has enabled that in a way. So although with the degree, you're still following the same day one skills and competencies, but you learn it to a greater depth. And that's great if you want to work in referrals or hospitals and things like that. So I think that's the good thing. I think whether we think the OSCEs are a good way of assessing practical skills, I don't know. We have the MPL or other equivalents of the progress logs, portfolios that show that you are competent at tasks. And I'm guessing that the OSCEs are a way of quality assuring that. So making sure that you've said you're competent, now demonstrate to us that you are. I think the fact that they're objective is much, much better. But whether ultimately they are the best way of assessing practical skills, I suppose that'll be something we'll have to watch on. But I think from a profession point of view, we've come a long way. And I think, as I say, the main things for me is the fact that we can now have a variety of career paths that we can take, and we can diversify. So it's gone are the days of hiding in the dark room processing x-rays, which I used to like, actually, because it meant that you could hide for 10 minutes.
You had somewhere to hide.
Yeah, in the dark. So actually it was quite a nice, therapy room. But we can make real contributions to treatment plans of patients. We can get the post registration qualifications now as well. And I think also there's more and more awareness of the transferable skills that veterinary nurses have. So we've got a lot of skills that we can take to other veterinary allied industries as well. So I think I almost feel a little bit sad for newly qualified nurses, because they don't see the huge changes that we have. And honestly, there are massive changes. I mean, we used to rewash our swabs and sterilize them for reuse and all this sort of palaver. I'm not old enough to remember glass syringes or anything, but it's on the cusp of that sort of thing. But we've come on huge leaps and bounds, and it's, as I say, it's a little bit sad that newly qualifieds don't see those big changes that we do.
I think that's the thing. I say this a lot, but it's really difficult to recognize that progression while it's happening. But when that's why it's so important for us to spend time talking to and reflecting with people that have been in the profession for a little bit longer, because you do have that kind of breadth of knowledge of sort of and the history of where you've been personally, your journey in the profession as well.
Yeah, I mean, it's the thing is as well is that you never lose that passion for the job either. So we always say to people, it's not a job, it's who you are. And you have that passion, and it doesn't ever go away. So I always said, the time I don't get upset at an animal being put to sleep, or I don't really want to go into practice, is when you give it up. But I don't think you ever really lose that.
No, not at all. Perfect. So we've spoken a little bit about the past. Where do you see the future of veterinary nursing going?
Well, yes. I mean, I would really like us to see to get more autonomy, so that we can work more on ourselves. So I don't always think that we can follow human nurses exactly, but there are certainly areas of the way that human nurses work that we should be able to implement in practice. So as people going to see the doctor, we're quite happy to go and see the nurse for triaging, or for diabetic clinics, or blood samples, or checking treatments and things like that. But we don't naturally think of that from a veterinary nurse point of view. So I see that we would get a lot more autonomy and working by ourselves. So, for example, community nursing is a really good example. So we wouldn't have to work or be employed by the vet, but we could be out there helping clients with medications, wound management, for example, things like that. Now, I know that would mean more training, but that would give us the ability to choose which direction we want to take our career in. And if you can work in specific areas where you can become a practitioner, for, I don't know, I'm just trying to think now, diabetics, so you deal with endocrine disorders, or consultations, you head up the nurse consultations, and we can be utilized much more. And so I think one of the, I suppose, downsides of the training being so different and more in depth is that we don't always use what we've been taught. So if you can then almost find a niche that you want, you can go down there and actually use what we've been trained for, be used a lot more in practice. So that's where I'd like to see it. We even get to a point where you have a prescriber nurse, but you work in a particular area. So, and also that if we have better training for health examinations, we can then report to the vet, and the vet can say, right, go ahead with this treatment, and we can carry that out. So I think that's where I'd like to see nursing going, is where we have that autonomy, where we're using our training much more. And then that will lead us into getting more recognition, acknowledgement of the training and skills we've got, and then we're much more a part of the team. And I think sometimes you visit practices and nurses aren't an integral part of that team, but we should be in in an area, if you like, where the vets are asking the nurses for their opinion on the treatment of that patient, and that's where I'd like to see us going in the future. Yeah. I don't see why not. Blue sky thinking.
I think, yeah, exactly. Going off piece slightly, although it comes back to protect the title anyway, but how much of that do you think is down to the fact that we're currently working under legislation that's, 60 years old, and it just doesn't match up with the skills that veterinary nurses now have?
No, I mean, it's crazy, isn't it, really, when you think about it, when that legislation was. Okay, we've had amendments with the Schedule 3 and things like that, but actually it's still very, very dated, and how far we've come in the last 10 years even. But even since COVID, I mean, COVID made a huge difference to the way that we work and what we do. So I think really what is great is the fact that we're going to be looking at that legislation. There is going to be reform. I know we keep saying this, but there really, really will be reform. And protect the title is just one step in that direction, I think. But getting that legislative change, that recognition of the veterinary nursing profession, I think will make a huge difference. And if we can also be part of that legislative change, so let's not just have vets making the decisions about what the Vet Surgeons Act should be. Let's look at it being as the Vet Professionals Act, and having vet nurses in those parties, those legislative working parties, putting forward what vet nurses should be doing. And then, yes, it'll make a huge difference to the way that our profession is recognised, looking at the knowledge and the training that we have and using us properly. But it's getting to the public as well. Yes. To me, we've talked about this, haven't we? And I don't think the public truly understand what we do. But that's up to us. That's what VNAM's for. That's what this is all about. That month is raising awareness with the public, what the vet nurses do and how big a part of the team we are.
Absolutely. And I guess leading on from that, from a legislative perspective, what would protecting the title veterinary nurse mean to you?
Well, yeah, I've asked myself this quite a lot since BVNA took on the Protect the Title campaign. And I don't think there's going to be an immediate change in the attitude of vets even, and the public, or that it will make an immediate change to the daily working of a veterinary nurse. But I think it will make a difference to the way that vet nurses feel about themselves and about the profession. So we are passionate about the vet nursing profession. And I think we deserve that recognition. We deserve to be acknowledged for the training that we're doing. And I think Protect the Title is a step towards that. I don't think it's the end of where we're going to be, so that will be the legislative changes. But I think protecting the title will make a difference to how we feel about it. I think we're part of the best profession in the world. I know I'm slightly biased, but we need vet nurses to stand up and take part in this campaign and say, look, we want that recognition. And I think when we did the survey, when BVNA did the survey and the responses we got back from the public, that they had no idea that there were people who were looking after their animals that weren't trained and were calling themselves vet nurses. And we need to make that change. I think it's really, really important. And then we can get that recognition from the public. And I think that will make a huge difference, but also get recognition from veterinary surgeons as well, because I don't think we always get that. And you and I have talked about education a lot, but that's where I think educating vet nurses with veterinary surgeons at some point makes a difference. And if they can see how much we learn and how much what our training is, I think they'll utilise us a lot more in practice. And I think, you know, Protect the Title is a chance for vet nurses to make a difference of the way our profession is regarded. And I'm hoping that it will be paving the way for those legislative changes that we've been promised, where we can get that autonomy and more responsibilities.
Absolutely. I think along those sorts of lines, what's also really important to remember, because I know, you know, veterinary nurses can get really despondent, and certainly they did after the RCVS's last attempt to protect the title. But a lot of those conversations can start before legislative change. And I think that's definitely something that we as BVNA will be discussing a lot this year, in terms of, you know, we don't just have to wait for legislative change to start having those conversations as well.
Because that's what we were talking about, wasn't it? Is that really the survey and the report that you did showed that actually this is an opportunity. So 48% of the veterinary professionals that answered said that they knew somebody who was calling themselves veterinary nurse. And I honestly, hand on heart, did not think it would be like that. I thought we might get 2 or 3% that say it, because I just didn't think it was a thing. And I was amazed at that number. But what we need to be doing is seeing that as an opportunity, because most of these people are part of the team, their friends, their colleagues that we're working with. And the RCVS have said that, look, we can't do anything about it unless people report them. And we're not going to do that because they're part of the team. But what we've known about, what people have told us, is that they have started conversations in practice to saying, right, okay, let's train these people up. They've got this wealth of knowledge, experience. Why don't we use them more? So I think it's a great opportunity to get training, and I'm hoping that veterinary practices will start doing that.
Absolutely. And my final question already is, what advice would you offer to somebody who's considering a career in veterinary nursing?
Do it. Definitely do it. Best job in the world. And I said it before, it's not a job, it's who you are, and you'll never get over that. I never thought I'd still be nursing at 61, and okay, it takes me longer to get up off the floor, but I'm still there and I still get a buzz out of it. I think there's times when it is an emotional roller coaster. You're not going to get away from that, but there are more good days than bad days, and you're part of a team. And that's what's really nice, is that working in practice, you've got the support of your colleagues, and the knowledge and the skills that you learn. I mean, there's a huge amount that we do, and it's so satisfying seeing a patient trotting out at the end of it, you know, sort of greeting their owner and the owners. So you have to remember that it's not just animals you're dealing with, it's people. So I know that people used to come when I used to teach, and used to say, oh, well, I want to work with animals because I don't like people. Well, then don't do vet nursing, because there's a pertinent person at the end of the lead, and you have to deal with people a lot. And actually, you often seeing them at a really, really stressful time as well. So there's a real art in talking to people, but a huge amount of job satisfaction. I suppose the word of warning is that you might end up taking home a load of waifs and strays, which, as you know, Charlotte, I do quite a lot. But you have to be strong and say no sometimes. And also, I suppose, the recognition that you can't save all of the patients, but you can give it your best. You can try, but definitely, absolutely go for it. I always used to say, if you don't like cleaning, it's not the job for you. If you don't like doing long hours, it's not the job for you. But boy, do you get a lot of job satisfaction out of it. I'm slightly biased, obviously.
It's obviously a good career, as it's, you know, been pretty much lifelong for you, hasn't it? So
well, yeah, but it's also where it's taken me. So, you know, it's sort of, I'm now working for the BVNA. I've done teaching, I've worked for Mars UK and done various jobs with that as well. And that's all with my veterinary nursing qualification. And I couldn't have done it without those transferable skills. And, you know, it's an incredible profession. Very proud to be part of it.
Well, thank you, Nikki, for joining me today, and thank you to those watching or listening for joining us to celebrate VNAM 2024. Make sure you follow our social media, and check the BVNA website for details of how you can get involved in this year's campaign and competition. But it's really important this year especially, but every year, that we continue to really work to raise awareness amongst the public of what veterinary nurses do.
Absolutely.
Thank you.
Thank you.